Now that we've discussed all of these potential changes that may happen, and not to everybody, I'm here to tell you that there are options for management, and just because that there may be changes associated with the treatment of bladder cancer, it doesn't mean that we have to give up on being sexually active and having good sex after bladder cancer treatment. So if we look at our categories of how treatment of bladder cancer can impact sexual function, we'll look at some of the potential options of treating this. So with respect to psychological changes, we can work on strategies to improve psychological distress. With respect to partner-centered causes, we can work on strengthening intimacy and connection between the two of you. Life course-centered changes, we can look at reprioritizing sexual activity as something that you'd like to be included in your life. And finally, the physical changes, we can talk about numerous different medical, conservative, and surgical options for improving erectile function, vaginal and clitoral function. The concept of sexual adaptation is important. So what this means is that there will be changes, and it's important for us to recognize that some of these changes can be modified and some of them are here to stay, and we need to optimize the process on how to make the best of the scenario. So following bladder cancer treatment requires both the patient and their partner to work towards multiple factors here. So acceptance of changes that have occurred, that's really important. Flexibility in navigating management strategies. So being open to ideas of treatment of sexual dysfunction that you may not have previously required is really important in identifying something that may help optimize your function and increase your sexual satisfaction and quality of life. Similarly, patience for natural function to recover. So what this means is that in the several months to first couple of years after surgery, there may be some degree of recovery, and having patience for this recovery to occur is important. It doesn't mean that we can't use any additional therapies, absolutely, and as the goal is to use therapies during this time, but just recognizing that it may take some time for some of these factors to recover and your body to heal itself. Similarly, it's important to have patience for identifying effective management strategies for your sexual function. We typically use an approach of starting more conservatively and using more and more involved or invasive techniques to help sexual function. And the initial conservative options may be successful in helping you function, but they may not be. And if they aren't, having the patience to continue to use different strategies until we arrive at something that is satisfactory for you is really important. And this is also related to the last point of persistence. It's important to have persistence in communicating with your partner, being on the same page and keeping that dialogue open. Persistence in being sexually active with your partner. We encourage being active as early as a couple feels comfortable after healing has taken place. And there's been studies and literature that support this notion that couples that try to remain active in some form of sexual intimacy is really critical in predicting satisfaction and continued efforts to be sexually engaged. And finally, persistence in trialing multiple methods to treat sexual dysfunction. As I mentioned previously, there are numerous different ways of treatment for the various subtypes of sexual dysfunction that you may experience. And it's important to recognize that it may take several tries or dose adjustments or strategies to arrive at something that's working well for you. This whole process involves, grieving the loss of some of your normal function to arrive in a position that may be different than where you started prior to treatment. It's also important to move forward with the idea of new ways of being sexual and this may require some adjustment of how you view yourself in terms of your sexual function and what's required to be sexually active and have satisfaction with that. So we bring this back to communication. Now, communication is so important in these scenarios following treatment in order to maintain sexual function and intimacy. Communicating your thoughts, feelings, needs, and barriers to being sexually active with your partner are absolutely essential. Multiple studies have shown that communication is one of the most important predictors of sexual satisfaction following pelvic cancer surgery impacting sexual function. Some of the tips to consider optimizing your communication is to be transparent and be open. It's really difficult to guess how your partner is feeling about things and thinking, and guessing this may lead to misunderstanding and frustration. And this isn't unique to communication about sexual function and intimacy. I'm sure everybody can think back to a scenario where guessing what the other person was thinking led to a scenario that was less favorable. So that's really important here, especially when oftentimes couples are less inclined to talk about some of these things. So it's important to bring this to the surface and keep an open dialogue. Discussing what's working and what's not working is also really important in order to be able to move things forward and find more things that are working and avoid those things that aren't working. For some couples, it might be difficult talking about this. If this is the case, you could try writing out your thoughts, different ways of communicating, or consider making an appointment with a sexual health clinician who's trained to navigate these discussions. If you're fortunate to have a cancer survivorship program related to sexual dysfunction in your area, then this is an excellent clinic to engage in. If you do not have one of these clinics available to you at this point in time, sometimes therapists or sex therapists can be really helpful with this. And essentially these are people with a skill set for counseling and navigating relationships that also have training with respect to sexual function and intimacy. So they can be a very valuable resource. Now, in terms of the interpersonal or relationship items, intimacy is really important. Now, to define that, we hear this term often. Intimacy involves feelings of emotional closeness and connectedness with another person and the desire to share each other's innermost thoughts and feelings. Intimate relationships are characterized by attitudes of mutual trust, caring, and acceptance. Now, most of the impact that we've been talking about is on sexual intimacy. That's related to the touch of your partner, outer course or inner course for your sexual relationship. Now, it's important that we focus on that and work to improve this intimacy and sexual functioning, but it's also important to remember that there are other ways that you're connected with your partner, and to not ignore those factors as well, and to capitalize on making those present in your relationship. Intellectual intimacy, for example, involves the common thoughts and feelings that you have that you share together. Experiential forms of intimacy may include the things that you enjoy doing together on a daily basis. Emotional intimacy is where you feel connected emotionally with your partner, and you're willing to be vulnerable and share how you're feeling. And all these things together are really important aspects of our relationship with another person. So the summary of this slide is just to show the importance that as we're talking about working on sexual intimacy, it's also important to continue all these other forms of intimacy with their partner and maintain their relationship in all the other facets beyond sexual intimacy. With respect to life course center changes, so certainly with the uncertainty of treatment outcomes, whether you're recovering from surgery or treatment with bladder cancer, the anxiety around the diagnosis, or the risk of recurrence, these things can really change our perspective on what's important within our life and our priorities, what occupies our time, of what we're either thinking about or what we're willing to do on a day-to-day basis. It's important to communicate this with your partner of where you're at with how you feel this diagnosis and treatment has impacted your life perspective. And in many instances, accessing a counselor can be really helpful. And again, if you're fortunate to have a cancer survivorship program that you can access in your local institution, many of them will have access to a counselor that's trained specifically around cancer diagnoses and living with this and managing your thoughts and feelings surrounding it. With these things, naturally, everybody's priorities will change and your perspectives on what you want to think about and do on a day-to-day basis, but it doesn't mean that you can't be sexually active despite these priority changes and other thoughts, worries, and anxieties. You can still prioritize and work to ensure that being sexually active and connected with your partner, or if you don't have a partner, being sexually active is a priority. So these are things that are, often helpful to reflect on, discuss with another individual, whether that's your partner or a trained professional, such as a counselor. Now, with respect to the physical changes, we'll first start talking about erectile dysfunction. Now, the first line of treatment for managing erectile dysfunction often involves the use of oral medications or pills. There's several different pills available. Common ones that we've all heard of: Viagra, Cialis, Levitra, Staxin. Essentially, these medications are taken orally, typically 1.5 to 2 hours ahead of time, and these will help the mechanism in the penis to relax that muscle and trap the blood in. So in many instances, this may help bump up the rigidity of the erections. You still need the stimulation, the thought, everything that will initiate an erection, but this may allow you to achieve a more rigid erection. Okay, so for some men, these will be adequate and certainly get you to the point that will help with erections. And in other men, these may not be enough to achieve an erection that you can use for sexual intercourse or to level of satisfaction for other forms of sexual activity. Muse therapy is the concept of delivering a medication inside the urethra of the penis. This can be quite effective. Due to the mechanism of delivery, perhaps it's been less common, at least in my clinical experience, compared to some of the other options. Penile injection therapy. This is a really effective form of treatment for erectile dysfunction. Now, in this scenario, it doesn't necessarily matter if your nerves are intact or not, because the injection will function directly into the penis and work on the muscle within the penis directly. We have a wide dose range that we're able to use for men with erectile dysfunction using penile injections. Typically, you would perform an injection, and 5 to 10 minutes later, once we find the right dose, we would have the response of an erection. Now, it may take some time to find the dose that's adequate for any individual scenario, but typically it can be quite effective, and you can achieve an erection that lasts 30 to 60 minutes following the medication administration. Typically, it requires some teaching by a sexual health clinician, nurse, or physician, and just on how to safely use the medication, adjust the dose, etc. This is quite easy to achieve and is a very effective management option for erectile dysfunction in this scenario. Vacuum therapy. This involves the use of a cylinder that's placed around the penis, and typically there's either an automatic or a manual pump that withdraws the air from the cylinder and creates a vacuum. This vacuum then encourages blood to be drawn into the penis and fill the shaft of the penis. There's a ring that you can place on the base of the vacuum pump that slips off to the base of the penis, and this essentially traps the blood within the shaft of the penis, allowing for a rigid erection. The base of the penis can be a little bit soft, but the shaft can be rigid, and many men find this to be quite helpful in either sexual outercourse, self-stimulation, or even intercourse. Finally, a penile implant involves a surgery where cylinders are placed within the penis. Typically, there's a pump within the scrotum and a fluid reservoir to help activate this. Essentially, once this is in place, as in positioned surgically, the individual will squeeze the pump, which is located in the scrotum. This is all concealed under the skin. Several pumps of the pump will move fluid from the reservoir into the shaft of the penis. This will take the penis from a soft downward position to a rigid position similar to a natural erection. These are quite firm and certainly adequate for penetrative intercourse. The procedure itself typically takes about an hour and is well tolerated by many individuals, and with proper patient selection, over 90% of individuals are quite satisfied with penile implants in scenarios where other medical therapies aren't working. So this is also important to know as a potential treatment option available to each of you. With respect to managing vaginal and clitoral dysfunction, there are many different treatment strategies that can be utilized. Certainly using lubricants if the vaginal cavity is dry and causing discomfort can be helpful. Seeing a pelvic floor physiotherapist to help with muscle dysfunction in the pelvic floor, as well as to potentially rehabilitate the vaginal vault, especially if some of the tissue has been resected at the time of bladder removal. So this can be extremely important and effective therapy, and it's important to connect with a well-trained pelvic floor physiotherapist that can help you with this. Other stimulation devices like vibratory devices can be helpful in stimulating the clitoris. Now that if some of those nerves are compromised, if it doesn't expand and respond to sexual stimulus as well as it did prior to the surgery. The EROS device is essentially like a vacuum device that can draw blood into the clitoris with the goal of helping increase its sensitivity. And there's been some clinical research behind this as well. Some individuals have considered off-label PDE5 inhibitors, such as Viagra, as it works through the same mechanism in simulating the clitoris as it does in the penis. There is some question about hormone replacement therapy. This is not likely a treatment that most would use, as we think that bladder cancer is thought to be an estrogen-sensitive tumor and could be sensitive to hormone replacement. So for the time being, we typically don't use hormone replacement therapy here. Managing urinary incontinence for both men and women can be really important and have an impact on sexual function. Now, if continent diversions have been used for men and women in what we call the orthotopic position, meaning a similar position to the bladder where it once was, so that you pee through your urethra. In the female side, if it was urethral sparing, and on the male side, as the majority of the urethra is preserved due to the anatomy. Strategies to help reduce leakage of urine include emptying your neobladder directly before sexual activity. If the neobladder is empty, then there's less chance that the pressure being transduced into the bladder will result in leakage. Pelvic floor physiotherapy can also be really important, such as the use of Kegels and other forms of exercises. Using bands or devices to stop urinary leakage can also be very effective. As you can see in the bottom right, there's what we call a uro-stop device, and essentially it's a elastic band that you can cinch around the base of the penis that closes the urethra or the pee channel to block any leakage of urine that's coming out. Men and women might experience this leakage of urine on a daily basis, or more specifically during sexual activity, termed arousal incontinence, or at the time of orgasm or climax, called climacturia. If these strategies aren't working, there's also surgical options to treat urinary incontinence. This may include urethral slings, artificial urinary sphincters, amongst others. If you find yourself in this scenario where the more conservative options are not as effective as you'd like, then pursuing a referral to a urologist that is well trained in some of these reconstructive approaches would be really important to get an opinion. Now, if you have been treated and have an ostomy associated with an alleloid conduit, certainly this can have an impact on how you feel about things and pose some new challenges to navigate for sexual activity. Now, when you reveal when to discuss the presence of an alleloid conduit to a new partner, our experience has been that this is a pretty personal decision, and finding that time where you trust the individual and you'd like to be open with that person is probably best. Now, if you have an established partner and you're in a long-term relationship, we encourage involving the other person in this process as early as possible. So in many instances, speaking with a stoma clinician prior to the surgery may help alleviate some of the questions and anxieties surrounding this. Beyond this, once you have a stoma, optimizing the care for your stoma can give you the confidence that you're not going to have problems with leakage during sexual activity, so ensuring that the bag has a good seal and you do not have leakage throughout the day. Reassurance from clinicians such as myself that sexual activity, once you've healed, shouldn't harm the stoma. So it should be capable of different positions with your body, and any contact during sexual activity shouldn't be harmful for it. You may also consider some commercially available products and wraps that have been developed to help contain the bag and conceal the feeling of the plastic material for sexual activity. And there's multiple available over the counter at some specialty pharmacies, and if not, you can look online to see if there's any products that may be beneficial to you that you can identify with and you think would be helpful. So in summary, treatment of bladder cancer can impact sexual functioning. Access to a urologist or a gynecologist specialized in sexual medicine is really important to ensure that you're connected with all of these strategies that can be of benefit to you. And if you have access to a cancer survivorship program that also tailors to the needs of sexual dysfunction, that is certainly very important and can be a really good benefit to you. There's many different conservative medical and surgical options to improve sexual functioning. So ensure that you engage with a clinician to access these, and don't be discouraged if the first line treatments that you're using aren't as effective as you had hoped. In many instances, there are multiple different ways of treating sexual dysfunction, and chances are we can arrive at a position to improve the situation that you find yourself in right now. Adapting to these changes in sexual function is essential. This may take some time. Don't be too hard on yourself if you feel that there are some significant changes in the beginning, and it does take some time for you to recognize these changes and identify with them before you're able to move forward and challenge these changes to optimize your sexual functioning. And finally, open communication with your partner, if you're partnered, is essential to optimize your sexual satisfaction and really maintain your intimacy beyond sexual intimacy with your partner is really important in working through these things together. So with that, I'd like to thank you for your time and thank Bladder Cancer Canada for taking the initiative to create a webinar on maintaining intimacy following bladder cancer treatment. Certainly, if you have any questions surrounding this, feel free to reach out to Bladder Cancer Canada's email, as you can see below, info@bladdercancercanada.org, or you can call them 1-866-674-8889, or visit their website at www.bladdercancercanada.org. Thanks again for your time.